We're continuing to see a surge in coronavirus cases here in California. The state just surpassed 1 million confirmed cases, and now some Bay Area counties are hitting reverse on their reopenings. Joining us now is Dr. Stacy Valendra with Stanford Healthcare. And so we know we need to be wearing masks and social distancing. So what do you think is behind this surge? Is it simply fatigue, you think?
I think there's a number of drivers for this. Certainly fatigue is there. People are, of course, tired of the social distancing. It's not preferable, but it's also due to the weather. So as the weather gets colder, people are socializing indoors more. There's not great airflow. There's not the UV light from the sun that can help break down virus particles. So the transmission just goes up in those settings. And what's interesting about the masks, I know we've heard it so many times, but they're actually coming out with some data that the masks help not just the person. So we used to say when it first came out that the masks protect the people around the person wearing the mask, but now we think there's some good data for the mask protecting the person who's wearing the mask. So instead of you wear your mask to protect me, I'll wear my mask to protect you. Now it's really also I wear my mask to protect myself as well. So I hope that will really resonate with some people just to keep that habit up.
Yeah, important to drive that message home. And there's concern about the surge in cases, especially as we head into the holiday season. What is your message for anyone thinking of maybe traveling or making exceptions this time of year?
Yeah, so just given the increased numbers, of course, the risk of infection is greater once you leave your phone. But of course, that risk of infection also needs to be balanced with people's well-being, their mental health, needing to see family who might be going through hard times. And so, the traveling is not, recommended, but if people do decide to travel, there are some ways to minimize their risk of getting sick. And of course, like I just mentioned, wear a mask. I think that's the number one thing that we're really seeing is preventing that transmission. But also when you're traveling on a plane, we think the airplanes themselves are fairly safe. They have filters that are top of the line, hospital grade. But the really challenging time is as people are commuting through the airports. And so when you're going through the airports, just try to get through as quickly as possible. It's not the time to sip coffee, to eat. You can do that, maybe mid-flight as the air is, getting filtered in the plane. But just really try to get through those busy airports, the terminals, the shuttles, public transportation. Just try to get in and out of those places as quickly as possible.
And be focused while you do it. We're still waiting for a vaccine, but Pfizer's coronavirus vaccine is showing a lot of promise. What have the clinical trials shown so far?
Yeah, we had big news with just efficacy rates that were high as 90% with the Pfizer vaccine, and a good safety data profile. These numbers need to be interpreted with caution. This is not the end result of the study. This is only a midpoint. That midpoint is really designed to make sure that the participants are safe. We also don't know how that vaccine impacts subpopulations such as the elderly or people with underlying disease. We also don't know how long it will provide immunity. And so we're really waiting. The only way to find that out is to really have the requisite amount of time pass. And so they're planning to follow for 24 months from the time that the participants got the vaccine. So really only at that point are we going to start to see the final numbers.
What else can you tell us is left to do in that trial before it could be released to the public?
Yeah, so like I said, it's an interim analysis. So they take different groups. Some get the vaccine, some do not. And of course, nobody is giving these participants actual COVID. They're only getting the vaccine. And then those cases have to naturally arise as people go back out into the world. And so right now they have 94 cases in that trial of those COVID cases that have naturally arose. We need that number to get up much higher than that. I think it's 164, and that will mark the end of the study. At that point, we'll look at to get the final numbers as far as the efficacy. They'll look at the safety profile, and they also want to see the side effects being followed for 24 months after after they receive that first dose, just to look at what the long-term side effect profile is. So we will be waiting some time for the final results, but this 90% efficacy is quite promising, and it's frankly higher than most people expected.
And what's the status of the other coronavirus vaccine candidates? We have Moderna out there, also AstraZeneca.
Yeah, so Moderna's vaccine is very similar to the Pfizer vaccine. Both of these use mRNA technology. And what this does is, well, especially for the Pfizer vaccine, I know that it injects genetic material that reproduces the spike protein of the SARS-CoV-2 virus itself. And so once that spike protein is produced, your body recognizes that it's a foreign protein and it mounts an immune response. That's good because then when you're exposed to the virus later on, you already have that antibody immune response in place. So Pfizer and Moderna both use that type of mRNA technology to do that. Moderna is getting ready to release some of their vaccine trial information soon, but it really won't be ready for distribution until the spring if everything goes well. With AstraZeneca, they faced some more road bumps along the way with some adverse reactions, but they are hoping for distribution early next year. So we're hoping, 3 different horses in the race at least, that one of these are really going to come through for us.
It sounds like the finish line for all 3 will be sometime next year. Dr. Stacy Villinger with Stanford Healthcare, thank you so much for your time.
Thank you so much, Kyle.